Great to have your company on Sky News across Australia. Now, the Queensland Government has announced a multi-million-dollar relief package for people struggling with mental health issues during the coronavirus pandemic. Anna Rawlings joins us live from State Parliament for more. Anna, how will this funding help?
Well, Gleeson, this $28 million package will go towards helping Queenslanders who are struggling with a range of issues from mental health to drug and alcohol abuse as a result of the pandemic. The Queensland Mental Health Commissioner says that before this outbreak, 60% of Queenslanders were psychologically well, but he says that now we are more vulnerable. This funding will help boost support services. It means people will be able to access more help from at home, whether that's online or over the phone, and non-government organisations will also be able to apply for these grants. The state government says it's much needed funding.
It will support our non-government organisations to provide mental health services as well as drug and alcohol services to the most vulnerable in our community. Quarantine itself has an impact on people's mental health. Of course, grief does too.
Now, Gleeson, Queensland's confirmed cases of COVID-19 is currently sitting at 998. There were just 11 new cases overnight. The Health Minister says that that figure, coupled with the low transmission rate over the Easter long weekend, makes Queensland currently the envy of the world when it comes to its coronavirus response. But that doesn't mean we're going to see restrictions lifted anytime soon. Of course, we know now that schools will be online for at least the first 5 weeks of the next term, aside from accepting students of essential workers. Now, the Premier is urging people to stop asking or stop discussing when restrictions are going to lift. She says it isn't going to be anytime soon.
Can we all just put a hold on easing restrictions? Like I said, we are listening to the health advice, and the health advice is that we are trying to avoid what we're seeing in other countries happening here in Queensland. So we need to be listening to the health advice, and as we said, we're looking at 6 months.
What we could see happening in Queensland, though, is more specific data. At the moment, Queensland Health is releasing confirmed cases of COVID-19 according to regions. We could see that tightened and see details coming out of local government or council areas. Queensland Health says it would be aiming to provide a bit more information and a bit more accurate data if they start to release those statistics.
Anna Rawlings, thanks for joining us tonight from State Parliament. Much appreciated. All right, Prime Minister Scott Morrison has berated the World Health Organization over its support to allow China to reopen wet markets amid the global coronavirus pandemic. A number of Liberal MPs have backed the Prime Minister's response, slamming the political organisation for its shortcomings. One Liberal MP, Dave Sharma, believes we should have the right to demand transparency and accountability from China. He joins me now. Dave, thanks for joining us tonight on Sky News across Australia. Australia is due to give the WHO $16 million in funding support next year. Is it time that we sort of looked at whether, in fact, we should be providing support to this organisation, which has clearly let us down on so many fronts over this particular coronavirus crisis?
Look, Peter, I think it's certainly advisable that we condition our continued support upon some much-needed reforms, and I don't think we'll be the only country seeking that at the end of this. The United States is the largest provider to the World Health Organization's budget, and I strongly expect that they'll be seeking some pretty dramatic reforms as well. And it's in our interest to do this. I mean, the WHO is a body that if we didn't have, we'd have to invent, but its performance has left a lot to be desired in this crisis, and we need to make sure that it's better equipped to deal with the next one, because it will happen again.
All right, so this is what the WHO... We'll get to wet markets in a second, but this is what the WHO said just a couple of months ago. They stalled on declaring a pandemic. They told countries to keep borders open, and they heaped praise on China, despite the Communist Party's appalling attempt to cover up the outbreak. 6 weeks was the delay from China in telling the world that this particular virus was happening. I mean, it's appalling behaviour, isn't it?
It's very troubling, and I think, we need a pretty thorough and comprehensive investigation at the end of this to determine exactly, what went wrong and who's to blame. I mean, I've made this point before, but the strategic and economic impact of the coronavirus has been, one of the biggest global shocks, certainly in my lifetime and going back at least a couple of generations. Now, that's, what you traditionally call a threat to international peace and security, what's gone on here. And if something like a nuclear weapon or fissile material or chemical weapons were allowed to escape from a country's control and custody and let loose into the world, well, we'd all be demanding an accounting and a reckoning at the end of this, and I think that's what we're going to have to do with the coronavirus. Now, I'm not suggesting that China did this intentionally or on purpose, but clearly some of their systems had some shortcomings, and the time that took to notify the rest of the world, I think, left a lot to be desired.
Dave, I found it interesting that Taiwan, which has not been allowed, by the way, to join the WHO, they saw the pandemic coming. They actually sent doctors over to Wuhan to establish just how bad this could be. They initiated strict social distancing in December, contact tracing measures which have held the virus at bay. But the WHO, pandering, of course, to the Chinese, kept it cut off from global information networks and refused to learn from Taiwan's success. I know you've got some thoughts on this.
I do. I mean, I think this has been one of the most troubling elements of the WHO's behaviour through this. I mean, Taiwan has been an exemplar, as you mentioned, in dealing with this crisis. They picked it up early on. They had experience before with SARS and avian bird flu and other sort of infectious diseases like this. They've got very good public health systems. And they're, in terms of size, they're a pretty comparable country to Australia, about 24 million people. So all of us, Australia included, could have learnt a lot and benefited a lot from Taiwan's experience, their knowledge, their own detection systems, their testing regime, their treatment regime, the epidemiology that their own data sets were pointing to. But the WHO, I think, took a far too political view towards this and said, well, because Taiwan's not a member state and because engaging with them might offend mainland China, they decided against doing it. And I think that's really putting, it's very obviously putting politics above the world's health and the health of the world's population. I think that is one of the most troubling aspects of the WHO's behaviour through this.
The Prime Minister has been quite strident today in his criticism of the WHO and the fact that they are still, in many ways, sanctioning wet markets continuing in China. Now, of course, we know that there is credible evidence that wet markets was the source for this latest coronavirus outbreak. I cannot believe that we're even having a conversation in the Western world where we in any way condone the fact that wet markets should continue, when clearly there is a link between wet markets and pandemics, not just the coronavirus, but SARS, MERS, avian bird flu. It's extraordinary.
It is extraordinary, and I think it's far too premature to even be thinking about doing such a thing. I mean, we need to have a pretty comprehensive investigation into all of this, go back to the single source, the point of origin for this as best we can, find out what caused it and what we need to do to prevent it from happening in future. But I think, as you said, the evidence to date strongly indicates that this emerged from a wet market. It's a common form of transmission for these sorts of diseases that allows things to jump the species barrier effectively, which is what's happened here. And until such time as we know exactly what happened and what sort of precautions and mechanisms we can put in place to prevent such a thing happening again, I think it's way too early to be even contemplating such a thing.
All right, so Donald Trump has also been quite critical of the WHO, and he obviously a couple of weeks ago was suggesting that they were glacier-like in their slowness in coming to the party with information on this. Where do you think America fits in to this particular debate and narrative right now, Dave? Because, the Americans are obviously incredibly disappointed with the WHO performance.
No, look, they are. And look, the Americans are still the most powerful and influential country on earth. They're the biggest contributor to the WHO's budget. They're a permanent member of the UN Security Council. So they have a lot of sway over UN bodies and UN agencies. And I think if they demand a fulsome investigation and a set of reforms at the end of all of this, and I expect they will, then it will happen. And I think we'd support them in this end. I mean, there is a contest, if you like, of narratives going on here about, who writes this story and part of what's happening with China and the United States and the WHO is basically trying to assert their narrative or their view of events. And I think that's something we need to be mindful of. There's always a bit of politics in any of this from all sides, but we want to make sure that we work on the basis of the evidence and facts and get to the bottom of this and make sure such a thing doesn't recur, or at least if it does recur, we have the early warning mechanisms in place to allow us to contain it at a much earlier stage.
Dave, I think every Australian will be behind you and Andrew Hastie and, of course, the Prime Minister as you try to get to the bottom of what's going on with the WHO. There is just no way we can even countenance the fact that these wet markets will continue once we get through this. Thanks for joining us tonight, Dave.
It's a pleasure, Peter. Great to talk to you.